That last visit to the emergency, the information was all there. That's got to be perhaps the biggest needs, is for that to be available to the ones who are going to be providing that care at the unit level.
As a patient, I think it's just wonderful. It makes me feel much better knowing that whenever I need help, I have a number, call, and when I really need them, they're there.
So HealthLink's a program that the ministry started a couple years ago to bring the major players in the health system, local health system, together. The original focus of the program was to keep the top 5% of hospital users out of hospital. The top 5% of hospital users drive roughly 2/3 of the costs in the hospital sector, and the idea was that if we focus on them, we could care for them differently and better, and also alleviate that cost burden from the healthcare system and the hospital system specifically.
HealthLink Sault Ste. Marie is a collaboration between partner agencies and social support agencies to provide better care to our patients.
We've decided to adapt the Johns Hopkins guided care model. What this model does is it's providing chronic care management by providing comprehensive coordinated continuing care. It's a partnership of a guided care nurse and the primary care provider with the patient and their caregivers. The guided care nurse, being the quarterback to care, works with the patients and the primary care provider to complete a coordinated care plan to help assist in the better management of care for a complex patient. And with that care plan, it gets disseminated out to all that individual's identified care team.
What's happened in the background is that the nurses presented with the patient before that appointment with myself, run through basically a care plan with the patient that outlines their medical problems as well as contact information. And importantly, some of the points of their care that the patient feels is important for them. And when they come in, we review that information and we come up with a plan. And that plan of care will then follow them from the office into the community as well as to the hospital.
What used to happen is healthcare providers and agencies would provide snippets of care, but nobody was really looking at designing or talking to each other to provide the best care possible. So it was all disparate and it wasn't connected. This model, it changes that.
All of their information is easily accessible in one document for a doctor that is not familiar with that patient to be able to access and view.
For me, what HealthLink is delivering on what our patients and family advisors have told us they want from a healthcare system. One, see me as a patient or as a person, not a diagnosis. Two, make sure it feels like one system for me, one journey, not a whole bunch of different stops. Three, make sure that my provider has the information they need about me wherever I am. And four, include me in the decisions about my care.
Well, I have a lot of issues, and I never know when one's gonna hit me first. And she comes, she checks my lungs, she takes my blood pressure. She makes me feel a lot safer, and she's there if I ever need her. Right in my home, I don't have to go anywhere.
For patients that might have questions about their health care or might have difficulty navigating the system, I think it really helps them feel secure and confident knowing that there's someone in their corner. I think it's a wonderful program.
It's great for the medically complex people who have multiple providers and who have a lot of complex health needs that need that extra attention, that need to be monitored a little bit more closely.
She has become sort of a liaison for us if I have concerns and perhaps I feel that things aren't happening fast enough, because Frank did have an emergency visit, and sure enough, that care plan was printed out and available to the attending physician at the emergency.
Well, being with Carrie, I pretty well know what's going on and how we're going to work together, and that's just wonderful. To me, it's the best, because makes me feel relaxed and no stress. That's the way I like my life.